Today we have Ms. Carmen Julius, who's the Executive Director of PALSS, which is the South Carolina most noted organization working with HIV and AIDS study in Columbia. So without any further ado, Ms. Carmen Julius.
Thank you for having me today. My name is Carmen Hampton Julius. I'm Executive Director of Palmetto AIDS Life Support Service. I'm originally from Kansas City, Missouri, although I've lived in South Carolina for about 30 years now. I attended Wilberforce University in Ohio and received a bachelor's degree in psychology and rehabilitation counseling. I also attended the University of Missouri at Kansas City. Done further study at Winthrop University. I've done further study at the University of California at Los Angeles, the Anderson School of Business. PALSS was founded in 1985 in response to the need for services for persons living with HIV and AIDS in South Carolina. Originally, PALSS was founded to be a support group or a source of support for families who were struggling with a loved one who had HIV. PALSS' mission is to provide education, health, and social services to persons affected with and communities affected with HIV and AIDS in South Carolina. We have a variety of HIV care and prevention programs. We have a variety of HIV care and HIV prevention programs here at PALSS. We conduct HIV and STI testing. That is testing for syphilis, gonorrhea, chlamydia, and other sexually transmitted infections. We do HIV prevention training, which helps people to understand how HIV is transmitted, what behaviors puts persons at risk for HIV, and helps persons to adjust their behavior in order to lower their risk for becoming infected with HIV. Or if the person is already living with HIV, it lowers their risk of infecting someone else. Our whole goal in our prevention programs is to reduce the rate of HIV transmission from one person to another. Other HIV prevention programs include our WISE program, Women in Search of Empowerment, which is a group for women that helps them to develop advocacy skills and HIV prevention training skills so that they are then able to go out into the community and teach other women how to reduce their risk for HIV. We have a group for men also. It's called Columbia Community Promise, and that group does the very same thing for men, teaches them what their own personal HIV risk is and how to reduce that risk so that they're then able to teach others how to reduce their risk for becoming infected with HIV. We have a program called HOPWA, Housing Opportunities for People with AIDS. It's a program that helps persons living with HIV to access and maintain stable housing, because we know that housing is an important link to health. We also provide counseling services for persons living with HIV. Those counseling services have a goal of helping those persons living with HIV to reduce their risk of infecting others. We do that by examining what issues they may have, whether they be substance abuse, mental health issues, financial and economic issues, or other issues in their environment that might motivate them to engage in risk behaviors. We try to lower their motivation to engage in risk behaviors and help them to maintain safer behaviors throughout the course of their life. We also have volunteer training and volunteer orientation programs here at PALSS. We're always looking for volunteers, always looking to recruit volunteers to help us out with our work in the community. We often participate in health fairs and do community presentations to provide HIV education in the community and help increase awareness of HIV in our community. Particularly in African American communities, we are carrying an undue burden of HIV. So we focus a lot of our areas on high-risk populations. Those high-risk populations are based on the incidence rates. So right now we're seeing a high rate of HIV among African American men, particularly men who have sex with men, and among African American women. So those are two populations that we are focusing a lot of our efforts and energy on. There are a lot of efforts and energy focused on youth, particularly youth of color, because those populations are showing high rates of HIV also. We do a lot of recruitment and outreach for testing among populations where there is an increased risk so that we can identify persons who have HIV but may not know it. We know that 1 in 5 persons living with HIV doesn't even know they have it, and that is what is driving the epidemic. So we want everyone to know what their HIV status is, so that if they are positive, we can get them in care, and if they're negative, we can help them to lower their risk of becoming infected with HIV. We really want everyone to make HIV testing a part of their regular health maintenance routine. When you go in to get your annual physical, we want you to also request an HIV test. Or if you're not comfortable asking your regular physician for an HIV test, you can come to an organization like PALSS, where we offer free, confidential, safe, rapid HIV tests. For a person who doesn't know what their status is, we recommend that you would come in immediately, get an HIV test, so at least you have a baseline of what your HIV serostatus is. At that time, we'll do some counseling with you about your risk behaviors and about what behaviors you're engaging in that you may not even know that is putting you at risk for HIV. And we'll help you to reduce those behaviors and talk about when you may need to come in for a retest, or if there is additional testing you need for other sexually transmitted infections. Risky behaviors include unprotected sex, of course, primarily unprotected sex, unprotected sex with multiple partners, not knowing your partner's HIV status, and of course sharing needles with drug-using partners, and particularly with partners that you don't know what their HIV status is. So we recommend that if you are in a relationship or you are planning to become intimate with someone, that you come in and get your HIV status checked, but also bring your partner in. You can come together, both of you can take your HIV test at the same time, and then that way you at least have an understanding of what your partner's HIV status is. What impact has HIV had on our children and youth? What we know is that there are a lot of grandparents now who are raising children because the parents have died from HIV, or the parents are impaired by HIV disease and are not able to care for their children. So, there's a term that's called AIDS orphans. We are seeing a growing population of children who are losing their parents to this disease. But additionally, what we are finding is that our youth are becoming infected at greater numbers. What we know is that when people test positive between ages of 18 and 24, they were probably infected at a younger age. And what we know is that risk behavior doesn't happen overnight. A lot of times, risky behavior begins as young as 10, 11, 12 years old, when youth begin to experiment with sexual behavior or experiment with drug-using behavior. So what we hope to do is reach youth at a younger age and begin to talk to youth about respecting their bodies and protecting their bodies, and making sure that our children, youth, and young adults understand what the risk behaviors are and how to avoid them. We think it's important that we have very frank and very open conversations with our children about HIV and HIV risk, and also have very frank and open conversations with them about sexual behaviors. I think that is something that we often kind of whisper about, or we don't talk about around our children, and I think that is putting our children at greater risk. So is there a direct correlation between the rates of HIV and the rates of other STIs? Yes, definitely. What we know is that persons with a history of sexually transmitted infections or sexually transmitted diseases are often at higher risk for HIV. Again, some of the same behaviors that put you at risk for other sexually transmitted infections put you at risk for HIV. And we often see co-infection in persons with HIV. People with HIV who are also infected with syphilis, gonorrhea, chlamydia, even tuberculosis and hepatitis. And so we know that there is a link between other sexually transmitted infections and HIV. And we know that we need to educate persons about the risk behaviors. Some of the risk behaviors are the same. And I think there is kind of a myth that TB has gone away and that hepatitis isn't as big of an issue as it is. But we know that for persons with HIV or persons at risk for HIV, hepatitis and TB are very serious illnesses. And we need to begin, again, to educate our community about the correlation between sexually transmitted illnesses and HIV and the impact that sexually transmitted illnesses have upon HIV and vice versa.
Okay. And just kind of further with that subject, are there any empirical numbers that basically list things in terms of age groups, which age groups are most highly prevalent, or are there any kind of trends that you didn't notice with ages with HIV? I guess the best way you could respond would be, your question would be, the high-risk groups of the ones are the teenagers, or the middle adolescents, or they're older?
Yeah, that's a complicated question because it depends on how you look at the numbers and what numbers you're looking at.
Okay.
Okay.
We can skip that
So
one.
no. So the question is
What age groups are more highly?
what age groups the question is what age groups are most at risk for HIV? And according to CDC, our goal is to make sure that everyone from 8 to 88 is tested for HIV. We are all at risk for HIV. It doesn't matter your age, your race, your gender. It's not about who you are, it is what you do that puts you at risk for HIV. Now, having said that, we are seeing increasing numbers again among youth and young adults. We are really focusing on HIV testing and HIV risk reduction training on persons from ages 12 up through about 34 years of age, because we are seeing higher rates of HIV in that age group. Again, in that population kind of moves because a person doesn't stay 30 forever. You become 31, 32, 33, 34. And we know that risk behavior is something that can follow you over a long term if we don't intervene and help to reduce risk behaviors in individuals. So anyone, again, can be at risk for HIV. We are particularly concerned right now about children, youth, and young adults. We want to ensure that they have accurate information about HIV and HIV risk. We want to make sure they have accurate information about what their personal risk is and how to reduce their personal risk.
Okay. I guess what I'm leaning towards is, the question was, can you expound on the number of cases in terms of any encouraging trends, or is this something that we've seen what are we seeing regarding the numbers based on the last couple of years? So
Absolutely nothing encouraging.
okay.
Well, okay.
Well, again, that's good. But again, if the message that we don't say.
Okay.
So basically, my question would be, in terms of trends that we're witnessing, what in our forecast for the future, this is what we're seeing.
What are the trends we're seeing in HIV and HIV risk? There's not a lot of good news right now about the rates of HIV. We are seeing the rate of HIV leveling off in some populations, but it's leveling off at a high level. Our goal is to bring those levels down. One encouraging trend that we're seeing is that among African American youth, condom use has increased. That is, condom use has increased among high school and college-aged African American youth. And we are seeing the results of that in reduced unplanned pregnancy, a slight reduction in the rate of sexually transmitted illnesses, and again, a leveling off in the rates of HIV. But again, we want to bring those rates down. So we want to encourage continued risk reduction behavior. We want to encourage HIV education among youth and young adults. And we want to continue to encourage and support that condom use, that we want to continue to support and encourage condom use, and we want to continue to support and encourage a delay in sexual activity among our youth, our children and youth. Bless you. Thank you.
Okay. My next question kind of leads to the fact that, okay, once a person has been identified as being positive, what's next? What is the course of action as far as treatment-wise?
So the question is, once a person has been tested and the test indicates that they are positive for HIV, what happens? When we test a person for HIV and that test is reactive, what we do is counsel that person about what a reactive test means. And we also ensure that that person is scheduled for a confirmatory test. That's a second test that uses a blood draw. Uh, and that blood draw is then tested to ensure that the test is accurate and that person actually is HIV positive. So basically, there are two tests run. There's a finger prick test, which is a preliminary test. If that preliminary test comes back reactive, we then do a blood draw and send that specimen to a lab for a confirmatory test. Once it is confirmed the person is HIV positive, we immediately connect that person to care, because we know that a person who gets into medical care early in their HIV diagnosis can live very healthy for a very, very long period of time. We also work with that person to ensure that they adhere to their medical regimen. We try to make sure that that person has as much information and education around their illness as we can get for them, because again, that ensures a more positive outcome for that person, that that person can live healthy for a long time. HIV health is based on adhering to your medical regimen, being a partner in your own health care, and having accurate and appropriate information about your illness. What are some of the myths around HIV? And there are so many. And of course, the main one is that HIV is a disease of gay white males. And we know that that is not true. Again, it's not who you are, it's what you do that puts you at risk for HIV. Additionally, there are a lot of myths and misconceptions around how HIV is transmitted and how HIV is not transmitted. We know that HIV is the disease that is born with, that is transmitted through blood, semen, vaginal secretions, and in some very rare cases, breast milk. It is not transmitted through saliva or sweat or any other body fluids, although very minor amounts of HIV are present in all body fluids from a person who is HIV positive. But transmission does not occur because, you know, somebody's tears fell on you or somebody who was sweating touched your hand. Transmission does not occur that way. Other myths are that there is some medicine that wealthy people get that keeps them from getting sick with HIV. There's what we call the Magic Johnson myth, that Magic Johnson and other wealthy persons have a different medication that they give to people who are not wealthy, and that is a myth. Magic Johnson takes the same medication as our clients take. I won't disagree that Magic Johnson probably has the resources to have personal trainers and nutritionists and dietitians and all of that. But he is doing what we encourage everyone to do: adhere to your medical regimen, keep yourself as healthy as possible. Other myths and misconceptions are that you can tell when someone has HIV. You can tell by the way they look, or you can tell because they lose weight, or that you can tell because there are certain symptoms. And again, all that is not true. The only way to know that you have HIV is to take an HIV test. I think another misconception that we run across a lot is about the preliminary HIV test. The preliminary HIV test is a rapid test. It's a simple finger prick, similar to what people do if they're testing their blood sugar. Simple finger prick with a drop of blood. You can get your results in as little as 10 minutes. So there's a misconception that the HIV test is very complicated and all of that, and that's simply just not. What is life like for a person who has HIV or who has been diagnosed with HIV? A person, for our clients here at PALSS, we encourage our clients to understand that they are living with HIV, not dying from it. It's about your perspective, it's about your attitude. If you understand that you are living with HIV, then your goal is to remain healthy for as long as possible. HIV can be a very unpredictable disease. But with the medications that we have now, with the training that our physicians have, people are able to live a very productive life, a very healthy life, a life similar to other folks. We have clients who have been living with HIV for 20 and 25 years now, who started businesses and have families and completed education and all that kind of thing, all the kinds of things that we would expect from any person living life in America today. So again, we encourage people to understand that you're living with HIV, that your role is to be a partner in your health care and to adhere to your medical regimen, and to get the services that you need to increase your quality of life, and you can live a very long time and have a wonderful, enjoyable, and healthy life.